Hello, everyone. We're giving folks just an extra minute to trickle in and get connected to their audio. So we will be starting shortly in less than 1 minute, but welcome. All right. So hello, everyone, and welcome to today's webinar titled, What Do You Know About the 2023 Tripledemic? My name is Stephanie Campos, and I will be your moderator for today. Real quick, we just want to give folks a few reminders before we begin, and I'm sure you're all familiar with it, but we want to make sure we're on the same page. Everyone will be automatically muted and your videos will be turned off during this webinar. If you experience any issues with your audio, we do recommend that you switch to phone audio, which you can get to by clicking that little arrow on the right side of the microphone icon at the bottom left of your Zoom menu. Also, this webinar is being recorded today, and the slides and recording will be shared with you after the webinar, after today. We'd also like to remind everyone that you can submit questions at any point during the webinar. We actually encourage it. We do ask, though, that you reserve the chat function for all other general comments. Joining me today is our wonderful producer, Rosie Georgievich. Rosie will be monitoring both the Q&A and the chat box today. So if you need any assistance during the webinar, please direct message Rosie. Today's webinar is a part of a national project called the Poder en Salud Power and Health Project, led by Proceed Inc. NASA, Center for Training, Support, and Technical Assistance. This project aims to increase the capacity of Latinx and other BIPOC communities at high risk for COVID-19 and other respiratory viruses to be able to effectively respond to the pandemic and to this fall and winter season through the engagement of trusted community-based organizations, tailored communications, and the mobilization of promotores trained to deliver prevention messages and other community mitigation strategies. To learn more about this project, please check us out after the webinar at www.poderensalud.org. Today's agenda items include a review of the webinar's objectives, followed by our feature presentation by Dr. Judith Flores. Then we will wrap up with an open Q&A session. And last, we will ask that you complete a brief evaluation of about 5 multiple choice questions. Today's learning objectives are to become familiar with the respiratory viruses co-circulating the U.S. during this fall and winter season, specifically this year, to consider the rates and risk factors for flu, RSV, and how the rates and risk factors of flu, RSV, and COVID-19 impact vulnerable populations, and to discuss how people at high risk for severe illness from these viruses can protect themselves and those around them. But before we jump in, we have a quick poll just to get a sense of who is in the room. You should see on your screen a 2-question poll. Thank you, Rosie, for launching that. Please take a moment to answer it. We want to know what state or region you're located in, and we want to get a sense of how knowledgeable you are about this tripledemic. Some are calling it tridemic or triple threat. So we will give you just a quick minute to respond to the poll. And I do see the results coming in. Okay. So it looks like 75% of you are coming from the Northeast, and also 75 majority do have some level of knowledge or somewhat knowledgeable about this tripledemic. Thank you, everyone, for completing that poll. Now let's jump right into our session. Before I pass the mic over to our presenter for today, Dr. Judith Flores, I do want to tell you just a little bit about her. Dr. Judith Flores is a fellow of the American Academy of Pediatrics. She earned her medical degree from Mount Sinai Icahn School of Medicine and was trained in pediatrics and community medicine at Montefiore's Albert Einstein School of Medicine in New York. She is board certified in pediatrics and healthcare quality and management, and has spent much of her career in primary care leadership positions in federally qualified health centers, hospital networks, and most recently as the chief of ambulatory care for several New York City health and hospital facilities. Dr. Flores remains in community-based clinical practice, educating and mentoring physicians, advanced level practitioners, and community health workers. Her professional career has been entirely dedicated to tackling health disparities. Dr. Flores, the stage is yours. Dr. Flores?
I am muted. That is
Here
a
we go.
mortal sin. Okay, thank you so much. So I just wanted to say that a lot of what I'm talking about is based on my professional experience and also my personal experience as a parent and a citizen of this country, and a person who is impacted by all the illnesses that we're going to be talking about. Every winter we have outbreaks. So what's different this year? What's different this year are a couple of things. But one of them, which is most important, is that we actually have available to us 3 vaccines that are safe and effective to prevent the most serious complications of these illnesses, meaning hospitalizations and deaths. I want to help people with this discussion get messages to prevent these illnesses out to their families, to their communities, and to help them avoid this triple epidemic, as we're calling it, and also pay attention to reducing the health disparities that we know impact a person's ability to get care, to access care, and to have good health outcomes. Next, please. So let's start with some information, some data. So I'm going to talk about the triple epidemic or the triple endemic and the immunity debt. There are some people that feel that we are now having more flu this season, as opposed to past seasons, more flu, more COVID, more RSV, more viruses in general, because of the pandemic, because our immunity has somehow been affected, because we were on shutdown, and that we're also seeing bacterial infections like pneumonia. Why more now? Are we more susceptible? Has our immunity changed? Those are good questions, and they're questions that we look at because these are seasonal infections, and with each season, the virus changes, and we change in our response to the virus. But it's important to know, next slide, please, that no matter what the outcome of this investigation, that lockdown that we were involved in, the lockdown was actually the right strategy for a new disease with a totally susceptible population, which we were. And it probably saved thousands of lives when we were in the middle of the COVID-19 pandemic. And I'm pretty much quoting someone from the Imperial College of London that has a global look at what has happened to us. Next. So again, what is going on? Why are we seeing more cases? Or why do we feel like this is going to be, over the years, even more serious? First of all, when we travel, so do our viruses. They certainly do not need a passport. The globalization and travel increases our risk. CDC monitors flu, RSV, and COVID-19 worldwide in order to give us a perspective of what's going to happen to us during the season. In the 21-22 season, over 250,000 children in kindergarten age were not fully protected against measles, which is something that I, as a pediatrician in practice for many years, have not seen in many years. We've seen a decline in immunization. We need urgent action to provide vaccinations that were missed during the pandemic. And that's one of the reasons why we may be seeing more cases. Next, please. Misinformation and vaccine mistrust. So it's very important to understand that this continues to grow. Who do we believe? So I put up a little slide here that shows you how many billions of people are on social media. And I just put in 4 examples. I didn't put in TikTok because I actually didn't have that data. But if you look at Facebook, if you look at Instagram, if you look at LinkedIn, which many of us use, and Twitter, which is now another service. So if you look at these media, billions of people are on them are active users on a daily basis. So what happens when you get an email from your provider or the practice or your physician that tells you that it's past time for you to get your flu and COVID shots? You can get them at the same visit, they tell you. But the Facebook friends say that this is suspicious and are sharing stories of vaccine danger. Who do you believe? Next. It's important to know that for the first time this season, so now we're going to talk about what's factual, what is the information that we have at hand. But for the first time this season, there are vaccines available to help protect against 3 of these major respiratory illnesses: the flu, COVID-19, and RSV. And getting vaccinated is still the most effective way to prevent respiratory diseases and their related significant complications. So the immune response that a vaccine awakens, it's also important to know, is just as natural as the responses that you get to the virus, sometimes even better and certainly less dangerous. So getting a vaccine gives you equal protection and puts you at less risk and less danger of being severely ill, hospitalized, or having a fatality. Next, please. Okay, so we know that among those who do not plan to get vaccinated, there are some top reasons. We know that more than 1 in 4 adults in the US do not plan to get vaccinated against the flu. That less than 1 in 2 adults have had updated COVID vaccines, the updated one, the ones that is effective this season against this virus. Less than half of adults 65 or older plan to receive the RSV vaccine. So all 3 vaccines are fully approved, continue to be monitored by the CDC for significant side effects. So we know that they are monitored. So far, there are no reports of significant side effects. And if there are, we will know about them. But yet the concerns about potential side effects and the general distrust of vaccines persists. Next. So what is the harm of skipping or delaying vaccinations? If we're going to not trust or we're going to question and put it off, what happens? Diseases once thought to be eradicated are coming back because people are not being vaccinated. We've seen it. We've seen it worldwide, and we've seen it here in the United States. We've seen outbreaks of measles, outbreaks, and other infectious diseases. Misinformation in the media has led many parents to delay vaccination. There is pretty much a very well-known case in which misinformation was spread about one of the vaccines causing autism. This was later refuted, proved without a doubt to be incorrect, and the person or persons responsible were really disciplined for this. And if you want to know the truth about autism, you can read The Truth About Autism, which is something that you can access yourself. But the bottom line is that no vaccine causes autism, and a lot of misinformation causes people not only to delay and skip, but can cause fatalities. And there have been children that have lost their lives to illnesses, including things like diphtheria, pertussis, tetanus, measles, which can kill, because of this belief. So, and there are other medical and social implications of not getting vaccinated. Not being able to go to school is one of them. Next. Vaccines help reduce your risk and stay healthy. So much research has gone into making vaccines. Many of them have been around for decades. Many of them are coming now to production after a lot of serious review and scientific research, and also clinical trials on human beings that had that showed the benefit of these vaccines. And most adults can benefit from vaccines, especially depending on their age and health history. Adults that are over a certain age, especially 60 years of age, will benefit highly from many of these vaccines. Children that are under a certain age, especially children under the age of 5, and particularly infants under the age of 6, can benefit from most of these vaccines significantly. It allows them to stay healthy, active. It prevents the serious complications that I've been talking about, even death, from certain infections. It also allows us not to pass these infections on to our family and into our community. It allows us to stay at work. It allows us to save money on medical costs and in general to take care of our family. Next. How much do you know about respiratory illnesses like the flu, COVID-19, and RSV? So I'm going to pull them all together just to point out some things that are common among them. You don't have to be an expert on these diseases or a virologist or even a physician to know that you can spread flu to others and most of these illnesses even before symptoms appear. And that is a danger zone. That's when people really are out in the community at work and play and don't know they have symptoms and they are spreading it largely to others. Illness can be more severe for certain people. We do know that. We saw that with COVID. Well, it's the same for flu and RSV. If you are, as I mentioned a little bit before, if you are children under the age of 5, adults 65 and older, pregnant people, and people with certain chronic health conditions, these groups are more vulnerable. Specific flu vaccines are recommended for people of 65 or older and for children and pregnant people. And particularly when you're 65 and older, the type of flu vaccine that is given is more concentrated and has more protection in it, because generally people that are older have a slower or less of an immune response. So the vaccine is enriched and enhanced in certain ways. Flu, COVID, and RSV vaccines cannot infect you. They do not contain live viruses. The severity and seasonality can vary. Some of you are on the call from Virgin Islands. You already had severity in some cases of flu. I know Puerto Rico did earlier this year. And now we're going into our heavy flu season up in the Northeast. So it varies with where you are in the world also. Antivirals can be useful to treat both flu if you take it within 48 hours of being symptomatic. And of course, COVID, if you take Paxlovid within 5 days of being ill, testing positive for COVID. So as you see, there's a lot of steps you have to take in order to be treated and a lot of wasted time by which maybe you're not going to get the full protection of this treatment. Next. Who was most affected by the infection? I know I mentioned this already, but it's worth repeating, especially since we know that only 47% of women are vaccinated. Pregnant people are vaccinated. So in order for us to be able to protect the newborn, especially in the first 3 months, pregnant people need to be vaccinated within the period of their pregnancy. In RSV in particular, it's important that they are vaccinated at the last trimester, or between 32 and 36 weeks when they're about to give birth, so that that baby gets protected for the first 3 months of life. In children and older adults, only 40% are vaccinated. This puts these two groups at highest risk. Those 6 months of age are at a very high risk. And I think it bears mentioning, if you have a history of heart disease and you are not vaccinated for the flu and you get the flu, you have a you have a 6 times greater risk of having a heart attack within the first week after your flu infection. So it's important to understand that some people and some groups of people are at greater risk. I do want to mention vaccination rates in our newest migrant population. The vaccination rates can be very variable. Some come from countries where they're very well vaccinated, some do not. Remember that their seasonality may be different. And in some cases, we don't have a good record of when they've had their vaccine. So, and we all know that when they cross, especially the Darien Gap, they have huge global exposure. So they have unequal access to health care. They may be stigmatized, and it's very important to pay attention to these populations and get them vaccinated. And lastly, we all should know that persons with immune deficiency, be they having cancer treatment, be they having AIDS or poorly controlled HIV, or another type of immune deficiency, have a lower response to these vaccines. So the vaccines and the treatments are often adjusted and their schedules adjusted. So it's important to get them vaccinated properly and early on. Next. So let's talk a little bit about flu itself. I'm going to break out now and talk a little bit about each condition and see if the differences, what the differences and similarities are. So flu, like the other two illnesses, is a contagious respiratory infection. You catch it by sneezing on someone, coughing on someone, having your conversation having what we call droplet contamination, being close to someone. So the same rules that applied for COVID, meaning social distancing, wearing a mask, washing your hands, apply. However, it affects the nose and throat and may spread to the lungs. It may cause mild or severe disease and can be fatal. I already talked about groups where there's increased fatality. The very young, the very old, those that are immune suppressed in particular. The best way to prevent it is by getting an annual vaccine. The flu vaccine you get this year is not the same flu vaccine you got last year. The flu vaccines are developed in response to the viruses that are circulating at that time. And the flu vaccine is prepared so it responds to the 2 strains of vaccine, strain A and strain B. So that's why the argument that, well, I already got the flu or think I got the flu, so maybe I don't need to get the vaccine this year, doesn't apply, because first of all, you may not even know if you had the flu, but even if you had the flu, it is not likely you had both strains. You had either strain A or strain B, and the vaccine will help protect from the other strain. Next. Respiratory syncytial virus, RSV. RSV is a common virus. It can be as mild as a common cold, or it can be very serious. When it's more serious is in the persons in this picture, the very young and the very old, or the older. Infants under 6 months and older adults may need hospitalizations. I cannot tell you how many children I've had to put over the years in the hospital, seriously ill, with complications, mostly serious lung complications related to RSV. It is a common phenomena that children under 6 months are at risk. If you're 60 years or older, a vaccine is now available to protect you from severe illness, and that is the RSV vaccine that you should be taking this season. If you're a pregnant person, you can get RSV vaccine, as I said before, between 32 and 36 weeks, and that will help you protect your unborn child. And remember, you can get all 3 vaccines at the same time. You can get RSV, COVID, and the flu vaccine. We will also be talking a little bit about the protection we can give newborn infants. No, we already talked about the protection that you're going to give the newborn infant when you are pregnant and get vaccinated. Next, please. So let's look at RSV in particular. Who's at risk for RSV? As with the other respiratory illnesses, the young, the very young in particular, the children. We have here a baby that's 3 weeks old, and we have a 3-month-old. We have the older adult. Maria happens to be 72. And we also have people with chronic health conditions. So someone with heart disease, diabetes, and a child with asthma can have more complications with RSV. Currently, we have 2 companies that are producing the RSV vaccine for adults 60 and older. And you only have to take 1 vaccine, obviously, but there are 2 companies that produce it. There's one vaccine in particular that's produced for women, for persons who are pregnant, and again, administered to protect the infant at 32 to 36 weeks of pregnancy. And there's an RSV preventive antibody that many of us as pediatricians are very excited about, that we can actually give the infants during this season. However, it is not as readily available, and we're encouraging many people to make sure that pregnant persons are getting the RSV vaccine to protect the infants. Next, please. Let's talk about COVID. So the end of COVID. The pandemic is over, but COVID is not gone. Next, please. COVID continues to pose a health threat. So we're seeing now during this season in the Northeast in particular, we're seeing an increase of hospitalizations and people becoming infected and sick with COVID. The hospitalizations numbers are rising, but the people at risk usually are the older adult and also the person with a chronic illness. The vaccine is more specific and provides better protection this year. So if you had the COVID vaccine last year or last season, even if you had 3 or 4 of them, it doesn't protect you that well against this particular variant. It is mutated. That's how viruses survive. This particular variant doesn't seem to be causing as much fatality as others, but is increasing the risk of people that are older and children that are younger. So it's still a serious illness in children, and we do vaccinate everyone with the new vaccine over the age of 6 months. Next. We're running out of time. So vaccines work very, very well in developing our immunity, but vaccines take a little while to get up to speed, to really give you the major effect, about 2 weeks. And if we're sitting in the end of the middle to the end of December, in 2 weeks, it's about Christmas time, or the holidays when people are getting together for Christmas, Kwanzaa, after Hanukkah, whatever your celebration is. And that means a lot of exposure. So if you want to reduce your risk, this is the time to get your COVID vaccine. And it's also important to remember that you can have co-administration of vaccines. That means that you can take your flu vaccine, your RSV vaccine, and your COVID vaccine at the same time. You can also do it if you're pregnant and you're taking other vaccines during your pregnancy. You can also take these vaccines at the same time. This year, we're lucky. We have the vaccine, but we have to move a little quickly because we will be running out of time. I will emphasize, though, that you can get vaccinated anytime, and you should, if you have not been vaccinated, from the months, especially for flu, from the months of September through April. So please, if someone in your family or the communities you serve has not been vaccinated, has waited, encourage them to be vaccinated, even if it's a little later. But we are running out of time to get the best effect in our communities. So now I want to talk about complications. We have vaccinated, and we've been vaccinating children under 5 against pneumonia for years. Persons that are 65 to 64 years old are at increase for pneumococcal disease. So that means there is an increase in the community, especially if you've had a virus like influenza that predisposes you to have a bacterial infection like pneumonia. Adults 65 and older are really at greatest risk. So vaccines need to be a part of the new normal to prevent individuals from becoming ill with viruses and bacteria that are in the community and are seasonal and we are exposed to. So I guess the take-home message is to get your children vaccinated, because included in their annual vaccinations are vaccines against pneumonia that protect them. Included in their vaccinations are flu vaccines, RSV treatment if they're young, and also COVID vaccine. And also, if at any age, you should be looking at what vaccinations you need for your particular age and risk group, and where you live and where you work and how you travel. So vaccines are really part of all our life cycle events. And it's important to know it's not just for children anymore. Next. So some people, some patients, many of you are working with patients in communities, and you come across patients that just need some clarity. If a patient asks you a question, keep in mind they may just need more information or insurance. Sometimes we come across people that say, I am definitely not going to get vaccinated. I don't want to hear anything else about any of this. And are very resistant. And I think that it's important to know that we're in the business of increasing vaccine confidence. And we are, in many cases, the reliable sources for people. And what we need to know is that we're in the business of saving lives. The CDC has provided bridge programs that allow people to get free vaccine coverage for the uninsured and the underinsured. They are available at chain pharmacies, community health clinics, and FQHCs, or federally qualified health centers. It's important to check with your local healthcare facility and Department of Health to see what's available in your community. We also have the availability to vaccinate children universally, because we have universal vaccine programs that cover these children, and we don't have to worry about payment there. The inequities continue. The highest risk is always among the highest risk communities are usually have the lowest rate of vaccination. So we need to target interventions to make sure that we're including people's needs for language, for their preferred language, for doing it within the social context of where they live and what their culture is and what is available to them. You're going to have resistance, and we all have resistance. I have it in my practice, but the tool I use is usually just listening to their concern and coming back with a consistent, reliable, verifiable message. Listening to people and coming back with good information is what has worked for me and for many. So I want to thank you for this time that you've given me to share this information with you, and I look forward to your questions. Thank you very much. We have resources. Please make sure you look at these. They're very useful and helpful.
Thank you, Dr. Flores. We also want to let everyone know that on the Poder en Salud website, there are also additional resource hubs for each of the 3 respiratory viruses that Dr. Flores just reviewed. But now it is time to open up our Q&A session. If you haven't done so already, please submit all of your questions by clicking the Q&A icon. Also, you may notice that at some point you'll see the evaluation link in the chat. This is for people that may need to log off early. So we do kindly ask that if you have to do so, to please take a minute to complete it before you leave. So Dr. Flores, I'm going to read to you some of the questions we've gotten in, and feel free to keep them coming. So the first one is, should a 27-year-old adult who suffers from asthma, question mark.
I think I know what the question is.
Okay.
I'll try. I'll give it a stab.
Give it a stab and let us know.
You're looking at 27-year-olds. Some people thought, especially around COVID, that if someone had asthma, maybe it wasn't a good idea to get vaccinated. Absolutely not. A person that has asthma has a chronic condition that puts them at greater risk when they have a respiratory infection, a respiratory virus like the flu, COVID, or RSV. Yes, a 27-year-old should be receiving their annual flu vaccine and their COVID vaccine. Absolutely. It will make that 27-year-old with asthma is at higher risk of being much sicker, being hospital, and especially being hospitalized with either of those infections.
Okay.
And the complication of pneumonia is greater in them. Just wanted to add that one.
Yeah, no, all the details are important. The other question is, should you get the RSV vaccine even if you have gotten the pneumonia vaccine?
Definitely. The pneumonia vaccine protects you against a bacteria that causes pneumonia. The RSV vaccine is against a virus that can cause an annual seasonal infection. They are not the same thing. They can affect the same parts of your body, but they're certainly not the same infection. You most definitely, if you are eligible for an RSV vaccine, you should get it, even if you've had the pneumococcal vaccine.
Okay. Somebody is just requesting to look at the resources slide again. I will display it, but just so you know, we are also going to be sending these slides out. And when you receive them as a PDF, all of these resources will be hyperlinked. So it'll take you directly to the source. Now we did get, oh, my apologies. I'm going all the way. I'm going to the wrong slide. We did get these other questions that had been pre-submitted. One of them was, why are Black, Hispanic, and other communities of color affected differently when it comes to these viruses, and what can we do?
I'm glad you put that question in. I think I actually put in a comment from someone that it's always the people at greatest risk have the less access. So some of it is access, the ability to have someone that you consider your doctor, to have a medical team taking care of you. Many communities, that's not available. There's also the issue of having things presented in a way that you understand, meaning in your own language, through your own culture, through a trusted provider. That's important. And there's also the let's be very clear, there's also a history of structural racism that people have had to live through, and that creates mistrust. And that hasn't gone away. So we have to understand that people that are working with communities that have suffered through inequities have to be sensitive to this, have to appreciate this, and have to work with people so that they can take control of their own health, the health of their community, and have better health outcomes. Because all these things create what we call health disparities, or it makes my outcome better than your outcome because you either live in a certain zip code, you have less access for care, you have maybe some disability that doesn't allow you to get care, or you just plain don't trust the system. So we want to be able to address those issues to be able to get better health outcomes in all the communities that we serve.
Mm-hmm. Thank you.
You're welcome.
Another one that had been pre-submitted too was how can or should we customize our messages around this triple threat?
I think the thing is, there's two things. First of all, you've got to listen to people and understand that people are tired. They're tired of vaccinations. They're tired of hearing about COVID. And now you're going to add all these other things. Oh, please, it's just a cold. I'm just going to go home and take care of myself. They're tired. But even though they're tired, the viruses are not tired. The illnesses are not tired. The fact that they can be hospitalized, that they can have a very bad outcome, that their child can be severely infected and have a very bad outcome remains a reality. So just giving the facts, the information, sharing it in a way that people understand that the truth of it is that this is a lifelong thing, that at each stage of our lives, we have to have the realization that there are tools like vaccines that allow us to live healthy lives, to prevent illness and live longer, and that we have them now and they are available to us. So it's just getting people used to the fact that vaccines don't go away when you're a child, that vaccines do not make you sick, that vaccines are tested and monitored for their safety, and that vaccines generally are readily available to us.
Okay, thank you.
It takes some work.
Right. It does sound like it's the same message, but it's also not. It's like the same message, but then you customize it for different people as you speak with them based on what their fears are. You mentioned their concerns, maybe even their
Yes.
motivations, so
Hmm.
that you tailor that message. That sounds helpful. A question that just came in is, do you need a prescription to obtain each of these vaccines?
You can go and make an appointment at a pharmacy, depending on where you live, and you do not need a prescription for the vaccine. The only time you need a prescription is for a very young child. You need probably a visit, a doctor's visit for the under 6 months. You can't go to a pharmacy and get it. In most places, children under a certain age vaccinated that way. You have to go for a doctor's visit, which is great because then they can take care of other things that are related to your child's health. But you do not need a prescription to go get your COVID vaccine, your RSV vaccine, or your flu vaccine at a pharmacy, depending on where you live.
Yes, and that's that bridge access program that you were
That's the
talking about
Bridge
too.
access. It's phenomenal. I can tell you that I got every single one of my vaccines that way. It was easier for me this year.
And it is active till next year. Actually, they did say till at
Yes,
least
yes.
next
And you can,
December.
yes. And you can get your pneumonia vaccine that way too. You can go get Pneumovax, you can get your shingles vaccine, other vaccinations. But yes, you can get these vaccines without a prescription at a pharmacy.
Great resource for people that don't have insurance or are underinsured.
Or a doctor.
Yeah, exactly.
Yeah.
So we do have
Yeah.
just one last question. It's out of the 3 vaccines that you talked about, which one do you recommend that people get first as a priority?
I recommend you get them all. Can you hear me? I
Yes, we can.
recommend you get them
Oh,
all together. I do not recommend you start with one and go to the second one. I do not prioritize any, I cannot prioritize. I don't know your individual circumstances. In general, you can co-administer, that's the word. You can take them all together. You have the same reaction as if you took them individually. It's easier, it's safe, and it's effective. And if the more you wait, the more likely it is in this winter season already that you're going to get sick. So I do not advise you to wait. I don't even advise for children to wait. Some people like to wait, so they wait a day or two. It doesn't matter. You should probably take them all together. The last thing is, if you're a pregnant individual, make sure that you understand you can take whatever these vaccines are for you, especially the RSV and the flu, with your other immunizations that you take during your pregnancy. Take them all together.
And they should take them even if they get infected. Like even if I got the flu, I should still get the flu shot.
Yes, yes. I think we talked about that a little bit already. If you think you got the flu, if you think you got the flu, or if you know you got the flu, remember the flu comes in 2 types. And that vaccine covers both strains A and B. And when you get sick, you don't know what strain you got. So once you get better, you're feeling better, go get your vaccine.
Wonderful. Well, thank you so much. And I want to thank everyone for submitting their questions, and even bigger thank you to Dr. Flores for sharing her knowledge, her expertise, her recommendations. We really hope that everyone learned a lot today. Please take a moment, if you haven't already, clicked on the link in the chat to complete our brief evaluation. It's about 5 or 6 multiple choice questions, so it's to take no more than a minute. Your feedback is incredibly important to us, so we will leave this up for just a minute before we wrap up. Feel free to scan the QR code on the screen with your cell phone or click on the link in the chat.
And thank you all for your support, and thank you for giving me this opportunity to share these messages.
Thank you. It's our pleasure. You are our favorite type of doctor.
Okay.
Okay. And last, we just want to let everyone know that after today, we will be sending you all a copy of today's slides. As I mentioned before, they are hyperlinked. And we will also share the webinar recording. We will also post this webinar and the Spanish version of this webinar, which we did earlier today, on our YouTube channel. Feel free to share it with others. If you have additional questions or are interested in receiving a training or any capacity building services, please do not hesitate to contact us. Our contact information is on the slide. Otherwise, we hope everyone has a wonderful day, and thank you again for coming. Take care.